The next couple of slides, I'm looking at Black or African American. I'm using the terms interchangeably based on the studies. Hispanic or Latinx, and Native American. Then I have some other slides for Asian Americans. So we'll start with Native Americans. Cardiovascular disease is more likely to be fatal in Native Americans with a mortality rate that's 20% higher than the general population. So if we look at the reasons why, I'm going to share some of the reasons in terms of the social determinants of health, but we should also acknowledge that the person impacts their health in addition. So we also always encourage our patients to lead a healthy lifestyle, which you all do with all of your patients anyway. So exercise plays a role, nutrition plays a role, so I don't want to discount that. But for Native Americans, what this data shows is 36% of Native Americans with cardiovascular disease die before the age of 65 versus 15%. So twice as many are dying earlier than compared to non-Hispanic whites. And that's one of the reasons for that is we're seeing a high incidence of obesity in a Native American youth. And living in Arizona, we have a Tohono O'odham Nation is the Native American community that I worked with, and I definitely saw that to be true. In terms of African Americans, despite similar clinical presentations, Blacks with acute heart attacks are less likely to be referred for coronary artery bypass grafting surgery than whites. And so when we think of that data, we also know that there is an earlier onset in addition of diabetes. There's an earlier onset of high blood pressure in the African American community. And there's a lower quality of care, which is what this data is showing in communities of color. And what's interesting in terms of the Hispanic or the Latino community, there's a lower cardiovascular mortality rate than whites. And I'll go over that in details. And so when we think about that, and in all of these groups, there's diversity. There's diversity among Asian Americans, whether someone is from China, Thailand, Vietnam, among the Hispanic community, whether someone is from Puerto Rico, Mexico, or Spain, among the Black community, whether someone's from Africa, the Caribbean. And so the data doesn't really tease that out as well as it should, but I just wanted to acknowledge that. And those subgroups are important because what we found in the data in terms of Latino population, Puerto Rican Americans were at the highest risk of having high blood pressure compared to other Latino groups.